Hello fellow DNP students, this is Erin McGuire and Chris Cavalinas, and our presentation is on data collection. The reference for this can be Chapter 10 of our text Clinical Research of the Doctor of Nursing Practice, written by Allison Terry. The mode used for data collection will vary depending on the research problem, hypothesis, setting, and population being studied. This presentation will highlight the nuances and the multiple types of data collection. The outcomes to achieve by the end of this presentation will be to describe the steps involved in instrument development, discuss the recent changes to the Health Insurance Portability and Accountability Act and the Health Information Technology for Economic and Clinical Health Act, and explain the different types of data collection, including their advantages and their disadvantages. The process of data collection actually begins during the literature review phase of research because this is where the researcher begins to define variables, establish how they will measure the data. Due to time constraints, researchers can choose to use instruments already created and tested for validity and reliability. Depending on the specifics of their research, the researcher may choose to create their own instrument. And if you choose to create your own instrument, there are 8 steps that are going to be unique to this development. You want to define the concept that's going to be measured. You want to develop items for the instrument, assess content validity, so does the content measure what the researcher intends to measure. You want to develop instructions for the participants, develop a pre-test for the items within the instrument, conduct pilot testing, estimate reliability or determine if the instrument will consistently give the same results during replication, and ensure validity to make sure the instrument is measuring the variables. The Health Insurance Portability and Accountability Act, or HIPAA, was amended on January 25, 2013 to include the Health Information Technology for Economic and Clinical Health Act, or HITECH. The new provisions outlined in these acts went into effect on September 23, 2013, and included several important changes. First, there is an increase in the civil penalties for willful neglect outlined in HITECH. These penalties can be up to $250,000 per violation, with a cap of $1.5 million. These penalties have been amended to include business associates themselves and subcontractors of the business associate. A business associate is defined as an entity that receives, creates, transmits, and/or maintains protected health information on behalf of a covered entity. Second, it is required entities self-report all HIPAA breaches, and each patient must be notified for an unsecured breach. Third, the U.S. Department of Health and Human Services is required to conduct audits of covered entities and business associates periodically. And finally, the patient can obtain their protected health information in electronic format from those providers that have an electronic medical record. Per Rothstein, there were some noteworthy impacts these HIPAA and HITECH changes had on research. First, it prohibits the sale of protected health information without an authorization, but spoke to one exception where the payment is a reasonable cost-based fee to cover the cost to prepare and transmit the protected health information. Next, it prohibits compound authorizations for more than one use of the protected health information with one exception. The exception allows compound authorization for the disclosure or use of protected health information in research treatment and storing specimens of the individual for research. Third, it made it possible for the research subject to consent to research in the future without stating the type of research. And next, it permits researchers to obtain authorization for the participants' health records indefinitely into the future. And finally, it addressed the incident of descendant health record disclosure. The new rule only protects the privacy of health records for 50 years. The backbone of all research, both qualitative and quantitative, is the collection of data. There are 5 types of data collection, including physiologic measurements, observational methods, interviews, questionnaires, and records. Each has their own advantages and disadvantages. Before this presenter discusses the how of data collection, there should be discussion on the who of data collection. Programmatic research is conducted by large teams of researchers collecting extensive data simultaneously for the benefit of the general public. This process takes a large amount of time and requires an extensive budget. To obtain this money, there must be proof of completion of multiple comprehensive projects. Next, this presenter will discuss the different types of methods for collecting data. Physiologic measures are typically sensitive, precise, and objective. This data includes data classically collected daily by the nurse, such as temperature, heart rate, respirations, blood pressure, and weight. It can also include test results involving laboratory values and radiologic examinations. The research must keep in mind there are several factors that could impact the findings and create slight variations. These factors include the reality that time can affect readings, such as blood pressure can change depending on determining if it's day or night. The accuracy of the instrument used to measure the variables, such as calibration of the blood pressure cuff. Position of the patient during testing. Blood pressure can change between standing, sitting, and lying. And the skill of the person acquiring the measurement. In this instance, reliability and validity are extremely critical. Having the same person taking the physiologic data creates reliability in the results. And some key terms to discuss here would be intra-rater reliability. This is the evaluation of many results obtained by the same person. There is inter-rater reliability, in which multiple persons evaluate the readings. And criterion-related validity mandates a comparison of the measure of the variable in question with the best existing measure. Observational techniques are methods by which an individual or individuals gather first-hand data on programs, processes, or behaviors being studied. They provide evaluators with an opportunity to collect data on a wide range of behaviors, to capture a great variety of interactions, and to openly explore the evaluation topic. By directly observing operations and activities, the evaluator can develop a holistic perspective or an understanding of the context within which the project operates. This may be especially important where there is not the event that is of interest, but rather how that event may fit into or be affected by a sequence of events. Observational approaches also allow the evaluator to learn about issues the participants or the staff may be unaware of or that are unwilling or unable to candidly discuss in an interview or focus group. There are 5 types of participant observation. In external participation, this is the lowest degree of involvement by the researcher, with the observation usually done via television or through videotape. Passive participation, the researcher is present at the scene with the subject in the role of spectator, but does not attempt to interact with the subject or participate in the scene. For a balanced participation, the researcher walks a tenuous tightrope between being a participant and a spectator. The researcher is not a full participant in all the research subject's activities. For active participation, the researcher generally does what the majority of the participants in the research setting are doing. Active engagement by the researcher will occur as he or she learns the rules of the research setting. And for total participation, this is the highest level of involvement for the researcher and means that the researcher becomes a natural participant. This is the type of observation generally used when the researchers choose to study something in which he or she already functions as a natural participant. Observations can be useful during both the formative and the summative phases of evaluation. For example, during the formative phase, observations can be useful in determining whether or not the project is being delivered and operated as planned. During the summative phase, observations can be used to determine whether or not the project has been successful. The technique would be especially useful in directly examining teaching methods employed by the faculty in their own classes after program participations. So the advantages to the observational methods is they provide direct information about behavior of individuals and groups. It permits the evaluator to enter into and understand the situation or context. It can provide good opportunities for identifying unanticipated outcomes, and it can exist in a natural, unstructured, and flexible setting. The disadvantages to this method is that it's expensive and time-consuming. You will need a well-qualified, highly trained observer and may need to be content experts. It may affect the behavior of participants. Selective perception of the observer may distort the data, and behavior or set of behaviors observed may be atypical. The use of interviews as data collection method begins with the assumption that the participants' perspectives are meaningful, knowable, and their perspectives affect the success of the project. Although a variety of interview forms and question formats are used in qualitative research, their common purpose is to provide ways for informants to express and expand on their own thoughts and remembrances, reflections, and ideas. Informal conversational interviews that occur in the natural course of participant observation are of the unstructured, open-ended type. Formal interviews, however, often involve the use of interview guides that list or outline in advance the topics and questions to be covered. Interviews remain conversational, and the interviewer has the flexibility in deciding sequence and wording of questions on the basis of how the conversation is flowing. But the semi-structured interview approach takes data collection more comprehensive and systematic from one informant to another. Some studies also use structured, open-ended question formats where informants answer the same exactly worded questions but are free to describe their experiences in their own words and in their own terms. Interviews can be used in any stage of the evaluation process. In-depth interviews are especially useful when answering questions such as, how does the program look and feel like to the participants, to the other stakeholders? What do stakeholders know about the project? What are participants' and stakeholders' expectations? And what changes do participants perceive in themselves as a result of their involvement in the project? So your advantages to using an interview is that they usually yield rich data, details, and new insights. You're permitted face-to-face with your respondents. It provides an opportunity to explore topics in depth. The interviewer can experience the affective as well as cognitive aspects of the responses. The interviewer can explain or help clarify questions, which can increase the likelihood of useful responses. And the interviewer is allowed to be flexible in administering the interview to a particular individual or in particular circumstances. Your disadvantages to this method is it's expensive and time-consuming. You need well-qualified, highly trained interviewers. The interviewee may distort information through recall error, selective perceptions, or the desire to please the interviewer. And the volume of information can be very large and can be difficult to transcribe and reduce data. A focus group is a form of in-person interviewing useful for obtaining in-depth information from a group of participants on a specific group or topics. This interview technique consists of a preparation phase, formation of the group, interviewing of the participants, and analysis and reporting of the results. Focus groups combine elements of both interviewing and participant observation. The focus group session is an interview, not a discussion group, problem-solving session, or a decision-making group. At the same time, focus groups capitalize on group dynamics. The hallmark of focus groups is the explicit use of the group interaction to generate data and insights that would be unlikely to emerge otherwise. The technique inherently allows observation of group dynamics, discussion, and first-hand insights into the respondents' behaviors, attitudes, language, etc. Focus groups are a gathering of 8 to 10 people who share some characteristics relevant to the evaluation. Originally used as market research tool to investigate the appeal of various products, the focus group technique has been adopted by other fields such as education as a tool for data collection on a given topic. Initially, focus groups took place in a special facility that included a recording apparatus, whether audio and or visual, and an attached room with a one-way mirror for observation. There was an official recorder who may or may not have been in the room. Participants were paid for attendance and provided with refreshments. And as the focus group technique has been adopted by fields outside of marketing, some of these features, such as the payment or refreshments, have sometimes been eliminated. Group interviews may be used in addition to individual interviews in field research. In recent years, focus groups have been used in combination with other forms of data collection in both qualitative and quantitative research studies to generate data on designated topics through discussion and interaction. Group moderators direct interaction in structured or semi-structured ways depending on the purpose of the interview. When used as a sole research strategy, the focus group interview represents a distinct type of study with a history in marketing research. Therefore, researchers should limit their naming of the method to focus group and refer to primary sources for information on specific focus group strategies when planning to use this as the central data collection technique. The next type of data collection is the use of records or existing data for review, either in a different way or to answer a new research question. The advantage of this type of data collection is time saving. There is a reduction in time from the actual collection of data as well as the time for soliciting participants. This form of data collection does have some disadvantages too. Facilities may not be willing to let researchers access the records. Some records may have been destroyed or lost, so the records available may not be the entire sample, and this missing data may create a bias in the results. When looking at existing data, the researcher could choose to collect data on the organization by completing an organizational assessment. Terry lists 20 items to look at when conducting an organizational assessment. These include the stated purpose of the organization, the stated vision, the stated mission statement of the organization, also the stated values, major services provided by the organization, major facilities included as part of the organization, technologies utilized, the profile of the organization's workforce, including education levels by the employees, key requirements for employment, and workforce diversity, legal and regulatory environment of the organization, applicable occupational health and safety regulations. Terry also mentions accreditation, certification, or registration requirements of the organization, relevant healthcare and other industry standards, environmental and financial regulations applicable to the organization, organizational structure and governance system identified stakeholder groups at each level of the organization, identified suppliers, partners, collaborators, or distributors utilized, relative size and growth rate in relation to competitors, identified areas of innovation and collaboration, identified areas of strategic planning, and identified challenges in long-term sustainability. Content analysis can be seen as another form of using existing data. This is the transitioning of qualitative data into objective quantitative data to be used in communications. Content analysis typically advances through 8 processes. 1. The researcher must identify a theory and rationale by conducting a literature review to create a hypothesis or research question. 2. The researcher must conceptualize the study to decide on and define the variables. 3. The operationalization of the study must be completed and decisions regarding the collection and measurement of data must be made. 4. The research must decide how to code the variable and produce a code book. 5. The research must select a way to randomly sample the content. This is many times completed by period of time, issue, page, or channel. 6. The researcher should ensure training and pilot reliability by conducting training session for the coders so there is agreement on the coding of variables. This training will increase reliability. 7. Consistent coding will guarantee intercoder reliability. 8. Tabulation and reporting can be done in various ways, but tends over time in a typical way of reporting results. A disadvantage to content analysis: there is no guarantee to the accuracy of the data, therefore biases may be preset. For mixed method research, there are 2 types of data collection: concurrent data collection or sequential data collection. This method of research creates some potential hurdles the researcher must be aware of. For concurrent data collection, the qualitative and quantitative data is collected at the same time. Due to both data sets being collected simultaneously, the Institutional Review Board, or IRB, will require the researcher to describe the quantitative and qualitative data collection at the beginning of the project. The sequential data collection occurs when one type of data is collected first, either qualitative or quantitative, and the results of the first data influence the collection of the second data set. For this collection type, and depending on the research problem, one of the data results will have greater importance than the other. Regarding IRB approval, the sequential data collection method will only allow the researcher to describe the first segment of data collection, and it is probable the researcher will need to complete an addendum once the second segment of data collection is finalized. This presentation has effectively reached the expected outcomes listed in the beginning. Over the course of this presentation, the viewer has learned about the distinctions between the multiple types of data collection as well as the advantages and disadvantages. The viewer can describe the steps involved in instrument development. Furthermore, the viewer is aware of the recent changes to HIPAA and high-tech and the effect these changes had on research. We'd like to thank you, and we appreciate you taking the time to watch this presentation. Please feel free to reach out with any questions you may have regarding the process of data collection discussed in this presentation, and we will be happy to answer any of those questions in the discussion forum. Thanks.